we're here at the emergency room at Penn State Hershey Medical Center. Tell me a little bit about the ground E.M.S. program that's here.
Sure. The ground E.M.S. program of Lifeline as a whole was one division, two parts, the ground E.M.S. and of course the most recognizable side of it is the aeromedical team. The ground E.M.S. side has 14 ambulances. We cover multiple municipalities throughout the Hershey area, 7 municipalities total. We do about 14,000 calls a year, and we're based to the emergency medicine department here at the Med Center.
Well, it's interesting you say 14,000 calls a year because both Todd and I, in our previous lives, ran ambulance when it was still ambulance, not E.M.S. And you would be lucky to get your emergency crew out and maybe a second crew. Many times we would scratch, and that was always the advantage of turning it over to the hospital, was to have the professionals, the full staff, and now you have 14 ambulances.
Correct.
So that's certainly better for the community, better for the patient.
Correct. Yeah, we have 14 ambulances total in the fleet. Our PAR staffing during the day is 9. We do have the capability in a disaster, whatever, to put the extra trucks out. But during the day, example, 2 o'clock in the afternoon right now, all units are working, whether it be non-emergency transport in or out of the hospital or 911 call throughout the municipalities.
Yeah, for the people that are watching, what you don't know is that we spent about 20 minutes or half an hour waiting for one of the ambulances to come back from a call and back into the emergency room, and about as fast as the patient got out of the back of the ambulance, we're using the side of it as our backdrop. So they truly are very, very busy, constantly running calls. And I think one of the things that I'm most proud of on your ground transportation is all the communities you are involved in. Correct. It's not just Hershey.
Correct. We service Derry Township, Conewago Township, Hummelstown Borough, Lower Swatara Township, South Hanover Township, and then in Lebanon County we service Palmyra Borough, North and South Londonderry Township as well. And then we do mutual aid anywhere outside of that. We
understand how that works. Now specifically, tell me a little bit about the pediatric side of that.
Sure. The Lifeline E.M.S. is the only E.M.S. service in Dauphin County to have been recognized as meeting voluntary qualifications for the Pennsylvania Department of Health's Pediatric for E.M.S. certification. It's a voluntary certification that came out. They identified a need for E.M.S. providers to have better training and equipment and other background knowledge on children. So in all the services in the Commonwealth, I believe right now there's only 60 E.M.S. services in the Commonwealth of Pennsylvania that have achieved the mastery level certification, which we have as well. So
I want to deal a little bit more on the certification level. Sure. Because my capital secretary actively still runs E.M.S. and I know there are certification levels for whether you're an EMT, a paramedic, whatever. A little bit about how all your personnel are trained at those levels.
Sure. On the ground side, we have a combination of emergency medical technicians and paramedics. They come to us with a great deal of experience. We do have some people just out of class, but it's interesting. I just was at a meeting this morning and I reported on this. The median age of our staff here is 42. It's a lot of years of experience, so we're very proud of that. So the people that we have working for us have a lot of years under their belt, come to us with a lot of knowledge. They have on the air side, we also have our critical care trained paramedics, and we also have the critical care trained flight nurses as well. They have a lot of ICU background.
I want to close on this portion of it with, we have a level 1 trauma center. Correct. Here at the hospital.
Correct. Adult and pediatric, yes.
Expand on that. When I say level 1, what's that mean? And it's both for adults and for the pediatrics.
Correct. So for a level 1 trauma center, we can take the most severely traumatized and the sickest of both adult and pediatric population. There are several level 1 trauma centers for adults throughout the Commonwealth. Penn State Hershey Medical Center is the only level 1 pediatric trauma center in all of South Central Pennsylvania. So you'd have to go to Philly or Pittsburgh or up to Geisinger for others. So
I think that's important for our residents to understand it. I mean, we've got the best of the best right here.
Correct.
Scott, thank you very much.
Thank you very much. It's an honor. Thank you.
Okay, we're in the back of one of the Penn State Hershey Medical Center E.M.S. units, the truck. Ed, tell me a little bit about the pediatric part of this E.M.S. unit.
We have a couple of different items here, different bags that we have our pediatric stuff. One of them is this one right here. One of the most important things that we carry in this bag is what we call a Broslow tape. That's this little piece here. And what that does is this will measure the infant, and once we get a size, it'll give us a general weight, and that'll also give us the dosage of medications that we have to give. It's a very good reference point that we really like to use there.
Yeah, I think that's important for the person who's not E.M.S. background. They don't understand. You can't just come in, give an infant an adult dosage of a medicine. That has to be the right medicine for the size, the weight of the body.
Absolutely.
And being a paramedic, now you coordinate everything through the emergency room, through the hospital.
Correct.
Like, I mean, if there are doctors on the end trying to help you out or tell you, you're relaying the information from the scene to the hospital.
Them. And then if we'd be looking for orders, that'd be outside of our protocol that we need command physician orders for.
Yeah, okay.
This is where we would go. We would call into the ER here.
In other words, as an EMT, you're qualified to do this much. As a paramedic, you can do this much. And if it's above that, you're checking with the ER doc on the radio to say, hey, we need to do this, we think. And
Correct.
You can send them the strips and stuff like that.
On the heart monitor, absolutely we can do that, which is the heart monitor right here. We can do an EKG with this. Okay, if we have something that is serious, out of the ordinary, something that we think that before we get to the hospital, this doctor should probably take a look at this EKG, we can send that by phone, that by the time we have the patient here to the hospital, that doctor will already have had that EKG, looked at it, and he can decide what he wants to do from there before the patient even arrives.
That's outstanding. Tell me a little bit of how many of the ambulances, the trucks that the hospital has, are equipped for pediatrics?
Every in-service unit is equipped the same for our pediatrics.
I mean, that's impressive. That's a lot of money tied up in a lot of rigs. How many calls did you run last year for pediatrics?
Last year about 197 pediatric calls, and of those 197 we had about 7 that were critical trauma patients.
Wow. I just can't emphasize enough how blessed we are to live in this area and to have this kind of state-of-the-art, not just the equipment, but the excellent personnel. And I want to thank you for taking time out of your day.
Thank you, John.
Thank you very much.
Thank you.